The strategy the United States is executing has 4 key goals: to control the epidemic at its source in West Africa, to mitigate the second-order impacts of this epidemic, to lead a coordinated international response, and to build a robust global health security infrastructure so we are prepared over the long run to confront epidemics such as the one we're facing today. Finally, I want to emphasize that the United States is prepared to deal with this crisis, both at home and in the region. Every Ebola outbreak over the past 40 years has been stopped. We know how to do this, and we will do it again.
We recognize the concern that even a single case of Ebola creates on our shores. But we have the public health systems and the public health providers in place to contain the spread of this disease. We've taken a number of precautions to prevent the spread. We've instituted exit screening procedures in West Africa to prevent those who have been exposed to Ebola or are sick with Ebola from traveling. The Department of Homeland Security is in the process of advising all travelers returning to the U.S. from countries with Ebola outbreaks in West Africa to monitor their health for 21 days and to immediately seek medical help if any symptoms do develop.
The situation in West Africa has been very difficult, largely due to the lack of an adequate health care infrastructure to deal with the outbreak. And so I want to reiterate what the Secretary said. Our health care infrastructure in the United States is well equipped to stop Ebola in its tracks. We are working very aggressively and energetically to develop and test a vaccine to prevent Ebola and therapeutics to treat it. We need to get information out because there is a lot of fear. And the reason there's a lot of fear is that there are many things when you have outbreaks. It's the unknown, it's the cataclysmic nature of it. Namely, it's acute, it kills in a high percentage, and it kills quickly. That in and of itself, almost intuitively, makes people frightened.